today I'll be discussing a few different topics I'll overview right now. So I'll discuss an overview of the Health Data Research Network, or HDRN Canada, the Data Access Support Hub, or DASH, and their services and processes. I'll also mention some DASH resources and tools, as well as a spotlight on one of our network members, DataNB. I'll provide some tips and tips for a successful application, and also at the end there will be an opportunity to ask some questions, so a little Q&A. Next slide. So first, I will start with an overview of HDRN Canada. To start, I wanted to touch on HDRN Canada's mission, which is to bring together people and organizations across Canada for transformative and world-leading health data use. The network was established recognizing both the strengths of our individual organizations and the barriers facing researchers conducting multi-regional research. Next slide. As a result, the Data Access Support Hub, DASH, was created to target an important strategic goal of developing and improving services to support data access. In this session, I'll mention how DASH can help you navigate the data access process and the centralized services and tools that will be available to you. Next slide. So I'll provide a brief overview of DASH. Next slide. The Data Access Support Hub, or DASH, is a data access service portal for researchers requiring multi-regional health and health-related data in Canada. So I'll begin with the question, why conduct multi-regional research in the first place? Multi-regional data can be used in many different ways. This includes assessing trends across Canada, validating study results in different provinces, studying rare diseases, getting a better representation of the Canadian population in your research, and also assessing the impacts of different demographics, provincial policies, and interventions. For example, a recent DASH research project that was supported examined specific trends in Alberta, and the researchers wanted to expand their study to other provinces to validate these research findings. Next slide. So what is DASH and what do we do? DASH provides a central coordination point for researchers who want to access multi-regional data from 2 or more of our member organizations. We also help to connect researchers to experts across Canada. There are several data center organizations from across Canada who are part of the HDRN network, and we work together to support data requests. These include provincial and territorial data centers, as well as pan-Canadian organizations such as the Canadian Institute for Health Information, or CIHI, and Statistics Canada. DASH helps with the facilitation and coordination between the research teams and the data centers to make the data access journey easier and more efficient. It's important to note that DASH itself doesn't hold any data, but that the data resides at the specific data centers, but we continue to follow regional specific legislation and policies when it comes to accessing data and data release. Next slide. So in this slide, you'll see some of our member organizations that make up the HDRN Canada network. We have representation from coast to coast, as well as those organizations that are pan-Canadian, such as Statistics Canada and CIHI. Today, you'll also hear from our partner organization at DataNB. Next slide. Since the launch of DASH in 2020, we have developed and streamlined processes to provide better support and coordination for researchers accessing multi-regional data. DASH simplifies the data access process by providing navigational support and coordination throughout the data access request process, offering a number of centralized resources and tools, which I'll touch on later in this session, working to make sure researchers can access data in a consistent and coordinated way across these institutions, and integrating technological solutions to streamline and progressively automate a data request process. Next slide. So here on this slide, you can see some of our DASH program statistics, and DASH is currently supporting around 20 active project requests and has completed 14 projects covering a wide range of research topics. Within all of these projects, there are some variations on how data is accessed or provisioned and how these requests are handled. And our team can help you navigate these requirements that vary between every jurisdiction. Next slide. So what kinds of data can be accessed through DASH? We can help facilitate access and linkage to data held at individual member organization, such as administrative data. So for example, hospital discharges or physician payment information, as well as clinical data. So this can be information from electronic medical records. We also help with accessing social data like education or immigration. And we also support opportunities for linking researcher collected data to administrative data with the appropriate approvals in place. We also have new data sources being updated on a regular basis. HDRN Canada works closely with data centers to support data acquisition of new data sources. For example, we're partnering with groups like the Canadian Partnership for Tomorrow's Health, or CanPath, and the Canadian Longitudinal Study on Aging, or CLSA, to bring in their cohort data to the provincial centers to make linkage to these data assets easier. In the next slide, I'll touch on one of these data assets. Next slide. So the Canadian Longitudinal Study on Aging is one that I just mentioned, or CLSA. It is one of our data sets that we are supporting through a linkage to DASH. This data set aims to explore health and aging with data on biological, medical, psychological, social, lifestyle, and economic characteristics. Many of our member organizations currently hold this data asset, which provides unique opportunities for researchers, especially when it's linked to administrative data. In fact, one of our studies supported by DASH explored administrative data linked to CLSA to study the relationship between aging and dementia. This example highlights how you can use various data assets to incorporate data from across the country to answer your research question. An overview of all of these available data holdings are provided in the data assets inventory, which is a resource that I'll speak on later in the presentation. Next slide. For those interested in conducting multi-regional research, DASH is here to facilitate a single coordinated path. This starts with step 1, query and consultation. If you're interested in learning more about the DASH services, how it can support your project, you can review our online resources or submit a query form. If you request a consultation with DASH, you can be invited to a consultation through our DASH team to discuss your project. We also have a service called HDRN Canada Office Hours. This is where you can drop in and have a conversation with our data scientists to discuss data availability and also support your data analysis plan. If you do decide to go ahead and submit a project to DASH services, you can create an account on our DASH portal to initiate the process. Next, as you'll see outlined in step 2, project submission and feasibility, you'll have an opportunity to submit an intake form outlining your project details. After receiving and reviewing the intake form, DASH will schedule an intake call with the research team to review the information that you've provided. At this stage, we bring in local DASH representatives from data centers to support any initial questions and provide some preliminary feedback. Once these steps are complete, you will receive a free feasibility assessment and cost estimate within 20 business days. When the project is deemed feasible and the researchers confirmed funding as well as a desire to proceed, the project would move to our next stage, step 3, the data access request stage. In this stage, you would complete a data access request form through our DASH portal, which undergoes an initial review by all of our members. DASH and the data centers will work with you to coordinate the necessary reviews, approvals, and agreements, as well as the data preparation and data access that's needed. Some data centers may also offer analytical service if it's needed. And in terms of timeline, the time to complete this stage can vary due to several factors and the complexity of the project. For example, if a project requires external data, or if a project has more members involved across our network, then this may be considered a more complex project and may require more time in this stage. Finally, in the last step, requesters can access data as per their local policies in their trusted research environments and will be invoiced accordingly. And I'll speak to the cost later in the presentation. Next slide. So here on HDRN Canada's Dash page, this is an example of the page that you can get in touch with our team or submit your questions, and we will connect with you to discuss whether your project is a candidate for multi-regional research. Next slide. So how can Dash add value to your project? Dash makes multi-regional research easier by connecting you with a trusted network of provincial and national data experts for personalized guidance and project support. We also provide a no-cost evaluation of your project's feasibility and an estimated budget for the data access. We can provide a unified letter of support from HDRN Canada to strengthen your funding proposal. We also coordinate your information requests through one streamlined online portal system. We connect you to tools and resources on topics such as privacy, informed consent, and analysis. We provide you with project coordination and administrative support throughout your research journey. And lastly, we'll highlight your research through our HDN Canada's national collaborations and outreach. Next slide. Now that I've provided a brief overview of Dash, I will share some resources and tools that can support your project. Next slide. So here you'll see some helpful tips and links that can help assist you with the initial development of your project. This includes distributed analysis, which provides information to guide your journey on performing one of these analyses you may need for your project. We also have our data assets inventory, which I touched on briefly before, but this is a repository of data assets available within our organizations so that you know which data you can request from our organizations. We also have our algorithm inventory, which includes information performed during a systematic review that identify published algorithms for measures of population health, health service use, and also determinants of health. We also have our privacy, ethics, and study design tools and resources, which includes information on health data related to privacy legislation, advice on disclosure of personal health information, and de-identified data. We strongly encourage that researchers browse these resources, especially before coming to Dash. Once the researchers have decided to move forward with Dash, they will have access to additional tools within our Dash portal. Next slide. So as mentioned, we offer tools for learning more about distributed analysis. So this is a way for researchers to do research across multiple data sources without sharing individual data. Instead of sending line-level data between each site, each location runs the same analysis on its own data. Then only the statistical summaries or results are securely shared with a central coordination site, where you can look and get the overall findings. This analysis allows researchers to use data that is generally can't be pooled across jurisdictions, maybe because of legal, ethical, policy, or other social constraints. So if you're interested in learning how you can utilize distributed analysis, I've provided the link here on the screen where you can review our resource. Next slide. Another resource that I would like to highlight is our HDRN Canada's dataset inventory. The data assets inventory provides information about the data assets that you can access through Dash for your research projects. So this is a great tool that you can use ahead of time to look on our website and search by region, by different data category, and also our member organizations. And you can also look up keywords. This can be a great resource to learn about the data that's available while you're developing your project. Next slide. You can also check out our fall office hours, which I did mention earlier. And this is a way that you can connect with scientists who can answer questions about methods, analytical services, and other things that can help you write a successful grant application. And this is a free resource that we offer with expert guidance, and will help you if you're interested in applying to grants and you want to continue to conduct multi-regional studies. Next slide. And the last resource I'll touch on is for researchers who are considering inclusion, diversity, equity, and accessibility, or IDEA, in their research. We have a lot of resources available on our website to help you. There you'll find different resources like frameworks, toolkits, and reports created by our organization and also our member organizations and our partners. We also have those shared resources as well. Here you can also access our speaker series webinars where we talk about ways that you can promote health equity in Canada, and you can register for upcoming sessions or watch recordings of our previous sessions right here on the website. And our next webinar will be in July, where we'll be discussing administrative data to study dementia in rural communities. So if you have any questions, please don't hesitate to reach out to our team. We're happy to discuss your research and help you navigate these resources. Next slide. So now I'll pass it over to Afton, one of our network members, who's going to provide a brief overview of DataNB.
Pardon me. Thank you, Jamie. I would like to start by thanking HDRN and Dash for inviting me to co-present today. My portion of the presentation today will cover some of DataNB's background information. I'll provide an overview of our data, and then we'll get a brief look at how data is accessed in New Brunswick. Next slide. DataNB got its start back in February 2014 with the signing of our inaugural operation agreement. In 2015, we were established as a research data center. Back then, we were known as the New Brunswick Institute for Research Data and Training, or NBRDT. As a data custodian, NBRDT offers access to administrative data sets that can be linked and placed in customized project folders. Our data is pseudonymous, which means the direct identifiers have been removed, but indirect identifiers remain. Fast forward to 2024, our operational agreement was renewed for an additional 10 years. And now, as part of our 10-year anniversary celebrations, NBRDT has been rebranded to DataNB. We want to assure you that while our name is new, you can still count on us to be the same trusted data partner. Next slide. DataNB continues to offer 3 trusted research environment locations, or TRE locations. Our primary location is on the University of New Brunswick, Fredericton campus. We also have 2 satellite sites, and they are situated in St. John, New Brunswick, on the UNB St. John campus, and in Moncton, New Brunswick, at the University of Moncton campus. At present, accessing data can only be done at one of these 3 physical locations. We are in the process of setting up remote capabilities. However, this service is not yet quite available. Next slide. Let's talk data. I invite you to review our comprehensive list of DataNB's holdings. Our website includes descriptions, code books, and variable lists via the website. New Brunswick may be small in size, but we are big in data. DataNB has over 130 platform data sets from over 20 data business owners and/or custodians. Each are available for approved research projects and can be linked. Data linkage is facilitated by our colleague at the Department of Health via our crosswalk process. Linkage happens using the New Brunswick Medicare card number or probabilistic matching. We also house project-specific data. These are not listed on our website as they are only accessible to the project team for the specific project for which it was transferred and approved. All data are maintained on a schedule as outlined in their specific data sharing agreement. And the DataNB Privacy Office completes a comprehensive privacy impact assessment for all data sets prior to transfer. Next slide. As you can see from the sampling shown in this graph, our top 3 data categories are health, education, and environment. Over half of our platform data falls under the health category. Approximately 1/3 goes to education, and environment and other round out our remaining holdings. The Department of Health and both provincial health authorities, Horizon and Vitalite Health Networks, have transferred multiple valuable data over the years. This category also includes data from CLSA and Atlantic Path. The education category houses data from the Department of Education and Early Childhood Development, the Department of Post-Secondary Education, Training and Labor, the Maritime Provinces Higher Education Commission, as well as data from our New Brunswick colleges and universities, including 2 data sets from a private institution. We have also worked with the Department of Environment and Local Government to transfer some impactful environmental data. Data from CNU and the New Brunswick Research Productivity Council round out this category. In the other category, we find very rich data, including demographics and immigration, social assistance, and the New Brunswick Public Library System. Next slide. Now that we've looked at the data, let's talk about how to access them. For multi-regional projects, once the DASH intake call is complete, we will do a feasibility review using the information provided on the DASH intake form. If feasibility is approved and you choose to proceed in New Brunswick, you will be invited to complete the DASH Data Access Request form, or the DASH DAR. Once we receive your DASH DAR, we will transcribe it to our local DataNB DAR, and if any components are missing, we'll reach out so that we can fill in all those missing pieces. Should the DASH intake or the DAR indicate that Indigenous data is required, DataNB will ensure that engagement with the proper communities have taken place, and DataNB is committed to respecting and adhering to the First Nations Information Governance Center principles of OCAP: ownership, control, access, and possession. Next slide. The newly redesigned DataNB DAR has been developed using the 5 SAFEs framework: safe data, safe people, safe projects, safe output. These 4 SAFEs will inform the 5th SAFE, which is safe settings. At present, DataNB offers on-site access only, so safe settings is not a concern. Our 3 TRE locations are secure, with safeguards in place to ensure that only approved users may enter, and they can only access project data that they have been approved to use. As previously mentioned, we are actively working on making remote access a possibility. Once the remote access is functional, safe settings will come into play. There will be guidelines for who can access the data remotely, where, and when. Next slide. For those of you who may not know, DataNB is also partnered with the Maritime SPOR Support Unit, or the MSSU. Through the MSSU, we have enlisted 3 public partners who participate at various points in the approval process. They review the DASH intake during our feasibility review to provide researchers with a public perspective. Their feedback will be included in the feasibility results. They are invited to participate during the governance stage as well, at our Data and Research Committee meeting. This allows the public partners to see how their feasibility comments were incorporated into the project. And they are also invited to review the project output, which enables them to see the final product. Their valuable feedback helps the researcher anticipate how the public may react to the findings once dissemination takes place, and identifies areas that may require clearer explanation to prevent misunderstanding or concern. When doing research in the Maritime provinces, the MSSU can also help to secure patient public partners to join your research team. This way, you have constant, valuable insight and feedback throughout your project. Next slide. The DataNB website contains all the DataNB Data Access Request approval information that you might need, including the mandatory administrative safeguards. It outlines the DAR approval steps, amendment requests, how to initiate data vetting, and the dissemination process. One note, one qualifier that I need to specify is that because of our DataNB rebrand, our website refresh is still underway. So we ask for your patience as we make all the necessary updates to our content and links. Now back to our DAR approval process talk. When a DAR has been submitted, there are 5 review steps that must take place. They are an institute review by DataNB, the Data and Research Committee review, and this includes our public partners and the data business owners. A review by DataNB's Preliminary Ethics Review Committee. A review and approval by the UNB Research and Ethics Board. And finally, the Data Access Request and the Data Access Agreement are sent to UNB's Office of Research Services for review and signature by the Vice President. Once the Data Access Agreement is signed, the project is active and analysis can begin. Next slide. These last few slides, I'm just going to breeze through, but they will be in the slide deck, so if you need to refer to them later, there is quite a bit of content on them. Feel free to do so once they're posted. So we have some rebranded socials since our rebrand. And we invite you to update your links and follow us. Next slide. We also have some rebranded and new email addresses. So again, we ask that you update your contacts for us. Next slide. Thank you so much for your time today. And now I'm going to hand things back over to Jamie.
Sorry. Thank you, Afton, for sharing this information about data access within DataNB. So I'll quickly finish off with some tips and tricks for a successful DASH application. Next slide. Before submitting your request to DASH, it's important to familiarize yourself with the local requirements and services. This table here outlines is also available on our website, and it outlines key requirements as well as additional details to consider in each region, including ethics approvals, remote data access, secure access environments, and software capabilities. The detailed table also notes some nuances within each requirement. So for example, some provinces or territories might require a local or affiliated principal investigator for your multi-regional project. Next slide. It's also important to understand the costs associated with using certain services. There's a range of costs associated with health data sets preparation and analytical services provided by HDRN Canada member organizations. While there's no fee to submit data requests through DASH, individual data centers do apply charges on a cost recovery basis. So once the DASH team has completed the feasibility review for a project, we can provide the research team with an accurate estimate of the associated costs that you would expect with your project. Next slide. So here you'll see summarized some tips for a successful application and also help reduce turnaround times. So we highly recommend reviewing our online web resources. I've mentioned many helpful resources today that can be found on our HDRN Canada website. You also want to be familiar with provincial and territorial legislation and policy for disclosure of patient-level data, data sharing across regional boundaries, and consent to link researcher-collected or external data. Also, having a well-defined study objective and the data that you need for your project will help identify the scope of your project, and it's also really important to minimize the need for amendments down the road. Most importantly, we recommend that you consult with DASH as early as possible for guidance, especially if there are any tight deadlines that you're working towards. We recognize the data access journey is complex, and we're here for you to help make it easier. Next slide. So for those of you interested in conducting multi-regional research, you can get in touch with our team. We're here to facilitate a single coordinated path from initial data inquiry to submission, to member review approvals, and finally provisioning of your multi-regional data. Next slide. And this is just a reminder that you can get in touch with the DASH team on the HDRN Canada website, where you can submit questions or request your data right there. Next slide. And finally, we also want to announce some exciting news that DASH is evolving to integrate our service to support more data users. So we're striving to support public health sector researchers, private sector researchers, and knowledge users, as well as others. This chapter will strengthen HDRN Canada's goal of developing and improving services to support data access across multiple users.